Hey, so welcome to Baby Mama's Doula, the podcast. Today we have a very special guest. We have Dr. Sarah Winward, who I have worked with Your Downtown Doula. So super, super excited to do this podcast today because this is where my journey began. And so it's a full circle moment just to have her speak today and share some of her expertise. So I'm going to give the floor over to Dr. Winward to introduce herself.
Hi, thank you so much for having me. I'm really excited to be here. Um, I'm a naturopathic doctor, lactation consultant, infant craniosacral therapist. I used to do work as a doula, and I always say like all of that just means that really I like live and breathe birth and babies. That's really it.
Perfect. So
Mhm.
my first question today was what inspired you to become a board certified naturopathic doctor, lactation consultant, and infant craniosacral therapist? And what is your focus in these professions?
Yeah. It's so funny because I feel like I kind of like fell into all of those things. Like I did my undergrad in like physics. And I started yeah, not at all the same thing. Uh, I started a master's and I was like, I hate this. I hate it so much because it's like so much computer programming. Like this is stupid. And I had a friend of mine who had like just finished naturopathic college, and I worked with her like in high school and in my undergrad. Um, and I was like, tell me more about that. And like my mom had seen a naturopath, and like I was like, this is what I'm gonna do. There was like no lead up. I like applied for the January start of the program in like November or December. Still had to do like 6 credits, which I was like, I'll just do them on kitchen, like on Athabasca University or whatever, like between now and January. And I applied for the January start and I got into the January start and I like dropped out of my master's and like switched to naturopathic medicine in like a 4 or 6 week period. And I was like, oh shoot, I have to do like a 6 credit university course in anatomy and physiology right now.
Wow.
Yeah, yeah.
Amazing. I had no
Yeah.
idea you had a physics background.
I have a medical physics and applied radiation sciences in my undergrad. I don't use it very often. Um, yeah, and then I like my business partner, we founded YDD together. She was like, "Do you know you like there's this like doula course running. It's like over a weekend. It's meant for naturopaths. Like it's a discount for students, like third year." And I was like, "Yeah, sure." It's like close to my house, so I was like, that's fine." And I went like totally on a whim, totally on a whim. Like Olivia was just like, "I think you would like this." Um, totally on a whim. Like, oh my God, I love this. I love this so much. And then like the second birth or third birth that I went to, the mom really struggled with breastfeeding. Like really, really struggled. And I was like, I have no idea how to help you. I have no idea how to help you. Like I just don't have these skills. And I could see how hard it was. And I was like, this is what I want to do. And so I like went, I was like, I still hadn't even graduated. I was in my fourth year at CCNM. And I was like, okay, I'm going to become a lactation consultant as well. And then I just did. Like, it was, all of it was like very, I was like, I'm just going to do it now. And then I was with the craniosacral therapy piece, I was referring out so much, so much. And then Megan Beam started doing a training, and I worked with Megan. I've run joint clinics with Megan. Like I'm doing the lactation consulting piece, and she was doing the CST piece, and it was like really these like really beautiful clinics with a charity called Birthmark. Um, and she was like, I'm gonna do a craniosacral therapy training, and I was like, I will be doing that training. Like the moment you run it, I will be doing that training. And my second baby was like 11 days old.
Mm. Oh my gosh.
I was like, I'm still coming. I'm doing it. So like we did the online piece. I was tiny, and I think at the time we did like the in-person piece, he was like 3 weeks old, and I was like, I'm just coming with a baby, and she was like, that's cool.
Yeah. Oh wow.
Yeah, yeah.
So a lot of positive whims that went along the way.
Yeah, yeah. I just was like, I'm just doing this now, so we're just gonna do it. Um,
I love that for you.
yeah. And then I think like everything has just been focused towards babies, new parents, like lactation, feeding, parenting decisions, like postpartum recovery. It's all of my entire practice is focused around that.
Amazing, amazing. Why
Hmm. Hmm.
are you doulaing anymore?
Because I have two kids.
Yeah.
And I just like don't, I feel like I just don't have, and I say that, but like I work with people who have multiple kids and are doulas. I just like don't have the stamina, I think. And also I find like with the lactation piece, people need support really quickly. And I feel like it would be hard for me to juggle like canceling on people to go to a birth. But that being said, like we have a really robust team. There's like six people on our team, six lactation consultants on our team. So I feel like I could if I wanted to, but I'm focused more on the postpartum now.
Yeah. That's amazing. That's amazing.
Yeah.
Okay. So the next question is, can you start by describing some of the common decisions new moms face in the postpartum period and what types of choices seem to weigh most heavily on them?
Yeah. I mean, feeding decisions, I think, weigh really heavily on people. And even like choices that are made during birth, like birth, sleep, and feeding. I think those are like the three most emotional things for me. And like the sleep people get really worked up about it in their heads, and then also the feeding piece. Um, because a lot of times you feel like you don't have a choice, right? You're like, people are like, I don't know, I like wanted to breastfeed and now all of a sudden my baby's refusing the breast and I don't know what to do and like how do I get out of this? And or someone just like told me in the hospital that I needed to give formula and now I don't know how to stop giving formula. It's a lot of times it's like decisions that were like forced on you. And then you're like, I don't like, people feel like they don't have the agency. Um yeah, and then that weighs on because they're like, I don't, how did I even get here?
Exactly. Well, I did
Yeah,
the top three, so it's interesting because I hear a lot of like when people are pregnant, their main concern is like, oh, once the baby's born, like how am I going to be able to sleep? How am I going to function with that? And then I
yeah,
think lactation, I do see that pop up sometimes where I think it's more stressed about the thought of not being able to lactate. So
yeah,
we're going to dive in a little bit more with some of those decisions in our
yeah. Well, and I think even like people, a lot of times when you're pregnant, you're like, isn't breastfeeding that's just gonna happen, right? Like I'll just do it, and then you get on the other side of it, and it's like I didn't realize X, Y, Z was gonna like how did all of this thing, all these things happen? I like didn't know any of this stuff, right?
sure.
Hmm.
Okay. So how does the postpartum experience differ for each woman, and how do these differences impact the decisions she makes?
Yeah. Oh my goodness. There's so because birth can go so many ways, right? Birth can go so many ways. How feeding can go so many ways. What your support system looks like is very different for different people. Like how people handle the hormonal shift, which it's like you have no way of knowing how you're going to handle the like combination of little sleep and hormonal shift in the postpartum period until you're in it. Like people can be like, but my periods were totally fine and I'm an absolute mess. Um, or like I usually do totally fine without sleep, but now I just like can't handle it, or vice versa, right? People are like, before I had a kid, I needed like 8 hours uninterrupted sleep, and now I'm running on like consecutive 2 hour, like 3 2 hour naps, and I seem to be doing it okay. There's so many, and and the personality of your baby too, right? Like different babies have different temperaments. Is one baby like only on you, and that's really hard for someone. Like there everything is, it's just a huge transition, right? It's because you're introducing a whole new person. The mom is now a whole new person because she has like brain changes, body changes, brain changes, hormone changes. Um, so it's like such a period of transition and you're literally like redefining your whole life.
Yeah. It's so
Yeah.
interesting, the postpartum experience, because I think I do a lot of like prenatal before they've had or up to labor and delivery. So it's so
Mhm.
exciting to kind of hear what you've seen in the postpartum sector. And yeah, I haven't even considered like you now have like a whole nother person. So
A
it's
whole stranger. It's
yeah,
like this whole just you just are sent home with a complete stranger.
who is this baby? One of my friends, and she was talking about her experience, and she was like, yeah, it took me a month to be like, oh, this is my son. And I was just like,
Yeah.
what do you mean? Like he was like growing inside of you. And she was like, yeah, like he didn't look like me. And so for a long time, I was just like,
Hmm.
who is this baby I've taken home? And when his features
Yeah.
changed, and I was like, oh, he's my baby. So
There it is. There it is. Yeah, totally. Totally. I had that with my first. I'm like, who is this? Like, I'm just expected to and then you also have this societal pressure of like, you should fall in love with your baby. It should be this absolute bliss. And like a lot of times it's not. I've heard people even say like it wasn't until my baby was like crawling at like 9 months that I was really like, okay, I actually kind of like hanging out with you. Like
it happens, and it's so
it
different.
does happen. And it's normal. It's totally normal. And then this is like another thing where you like people are like, shouldn't I just be in love with this person? Like, didn't I grow this person? Shouldn't I be in love with them? But like, no, it doesn't always happen that way, and that's totally fine.
For sure.
Yeah.
So my next question is, what are some of the toughest decisions mom face when it comes to balancing rest, self-care, and caring for their baby in the early postpartum weeks?
Hmm. Hmm. Um, I mean, I think like those early weeks, you're just like in the trenches. It's just like it's like so all 24 hours a day, like everything's going on. And so um you it's a balancing act, right? And it all of what it looks like depends on who your support system is, how far away they are, how things are going with like feeding the baby, because it looks really different for someone who breastfeeding's going totally fine and they can just like wake up, feed their baby, go back to sleep,
Yeah.
versus someone who's like, oh my God, the baby's not latching. I'm going to try to latch. I'm going to pump for 20 minutes and then I'm going to bottle feed and then I'm going to like wash, rinse, repeat in another 2 hours, right? Then you have to do this like triage of what can you handle and like what are your goals?
Mhm.
What can you handle in that moment? And like, what are the most important things for your wellness? Because you're not going to be able to do everything for your wellness, but you can do like two or three things for your wellness, right? Like maybe you're skipping one feed and getting a 5 hour stretch of sleep. Or maybe you're calling your mom or your mother-in-law or your friend down the street to like come look after the baby for 2 hours while your partner's at work and you need to just nap and you're like, I have to nap, whatever, right? Like, but what those decisions look like, it varies so much for people. And often you just like don't know until you're like right in it. So a lot of it is like, what are the top like two, three things you need for your rest and recovery and mental health? And then like what can you cut out that
Yes.
doesn't need to be there? And honestly, like from a lactation perspective, I am obviously like I'm a lactation consultant. I know all the benefits of breastfeeding. I'm like a very, pro babies getting breast milk person, but I 100% have had conversations with people where I'm like, listen, like this is not working for you, right? You've tried all the things. This is where you're at. Like, do you really want to be still doing this, or should we maybe think about cutting out the pumping, or like how can we make this manageable, sustainable, and pleasant instead of trying to like exclusively breastfeed?
Yeah, that's amazing.
Mm-hmm.
I think see when people think of naturopathic medicine, they think that we are very one way or the highway, and it's
Mm-hmm.
great to hear that your experience as being a naturopathic doctor, being a lactation consultant, that it is okay if you're unable to exclusively breastfeed. It's
Oh
okay
yeah.
those decisions and not have that guilt because I think there's a lot of
Mm-hmm.
guilt with a lot of these decision making. So it's nice to hear that, do you know what, it is okay to just make some decisions that will benefit your well-being because in turn it will also benefit the baby's well-being.
Yeah, like you have to you want to have the chance to bond with your baby and enjoy the postpartum experience. And if you're like crying every time you're pumping because you're not holding your baby for that 15 minutes and all you want to be doing is holding your baby, like is that really in your best interest? No, probably not. And you don't know, like you can't know these things until you're like right in it, you know? And I do like often it's like, I'll have two visits where I'm like, we're going to try everything that we can for like 1 week. And then if it's not working after 1 week or 2 weeks and we've done all the things, like how do we make this sustainable and what things can we drop and don't feel guilty about that because you it needs to be sustainable.
Yeah.
Yeah.
And the thing is like we said before, that each pregnancy is different. So I think sometimes we also see guilt that like with my first baby, I was able to exclusively breastfeed and I was able to
Yeah.
handle and manage everything. But now with my second baby, I can't, do everything. So it's nice that
Yeah.
have people that can kind of help navigate that, okay, this is the tools with these are the strategies that we should make. If
Hmm.
other tools or strategies you would suggest when it comes to making decisions in the past postpartum period?
Oh, I think just like being really open to accepting help. And it's like people who have that like type A personality, right? Like mom, where they're like, I just have to do everything right. I have to do everything perfect. Like I'm supposed to take care of this baby. But really, like you're not supposed to be the only one taking care of the baby. It's like only in North American society in the last 100 years that, not even 100 years, that like women have been stuck at home with a baby by themselves, like trying to do everything. And like you're not supposed to do that. You're not. It's not. That's not how this is supposed to go. And so like just like, and this is something honestly you can even work through like prenatally, like letting go of control, right? Like you have no control over how your birth is going to go, or like a very little control over how your birth is going to go, really. Like you can do all the prep, but like things are still going to happen. Um, and you don't know what kind of baby you're going to have. And so just like knowing what your options are in terms of support, and then checking in with yourself of like, how am I doing? And having your partner check in with you too, right? Like, how are we doing here? Is this manageable? And then enlisting help from friends and family or paid professionals, like based on what you need, and allow that to be different than you thought it was going to be, and allow it to change as the baby gets older too.
Yeah. I like how you said like checking in because I think a lot of time people don't check in every day. It's just like on the hamster wheel, it's just moving. And I think it's
Mm-hmm.
and check in with your partner, check in with yourself that, okay, am I okay? What do I need? And what does the baby need? So I love that you said that. Yeah.
Yeah, yeah. And I hear like I'll have consults with people where they're like, I really want to make sure things go smoothly with my second baby because with my first baby, like I was like triple feeding, which is like feeding, pumping, bottle feeding for like 10 months. And I like didn't even realize that I was still doing it and I didn't need to still be doing it like 10 months later. And I was like, oh my God, how did you do so much work? That sounds terrible. And they're like, and I had a terrible experience postpartum and I don't want to do that again. And I'm like, yeah, 100%. Let's not do that again.
So
And then I equally had people who were like, I triple fed the whole time I was breastfeeding and it was totally fine. So like you have to like know what's working for you, and also like situations change. Like I had someone recently who was like, well, with my first it was COVID, so I just like pumped all the time because like where was I going? Um,
yeah. It's interesting how different it is for each and every person, and with each and every pregnancy, it's really hard to kind of just know. You can't know beforehand how it's gonna turn out.
you really and I think too we like have societal, and with social media too, like this pressure of like it should look a certain way, it should be a certain way, you should be doing a certain number of things, like you got to go to the mom groups or the whatever public library things or whatever. And like sometimes it's just I I can almost guarantee that something about your postpartum experience is not going to be what you expected it to be.
Yeah, for sure.
Yeah.
How can new moms identify with their decisions that are influenced by guilt rather than what's best for them and their baby?
I think that's that pressure, right? Like, are you making this decision because you think that it's the decision you're supposed to make? Right? Or are you making this decision because it's the best decision for your family? And really looking at like, and it's totally fair to be like, I want to breastfeed. I'm going to try everything I possibly can to breastfeed and to be really invested in that. That's fine. But then, like, what else are you letting fall away? And are you okay with letting those things fall away? Right? Are you okay with like, not getting out of your pajamas for the entire day because all you're doing is working on breastfeeding. Do you know what I mean?
Mm.
You haven't left like not leaving the house for like 3 days because all you're doing is trying to get breastfeeding working, right? Like, are you okay with that? And if that's how if you are, that's the right decision.
Yeah.
But if you're like, oh my God, shouldn't I be doing this? And I'm supposed to be doing this. And my mom said this and social media said that and whatever said this. And it's not working for the baby that you have in front of you, like that's probably not the right decision. And it's I think it's getting harder for people to trust their instincts. Like I think um we have because we have so much access to information so easily. People are like, shouldn't I just be able to find the answer on the internet somewhere? And really, like, it doesn't make if you feel like you're fighting against your baby or fighting against your mental health or fighting against what makes sense in your household, like that's not the right decision. And you can only make the best decisions you can with the information you have at the time.
Mm.
And what works for one family, I always like to tell people like you're the expert in your own baby. And I remember in one of the Peds classes, and I should look this paper up because I quote it all the time and I like don't have the reference. I remember seeing somewhere that like one of the best predictors of a baby having an ear infection was the mom thinking the baby had an ear infection.
No way.
Right? Like not a fever, not them pulling on their ear, not red cheeks. Like the best sign or symptom was the like before you look in the ear was like the mom being like, this baby has an ear infection.
Oh, wow. That,
Right? I need to look it up. I need to look it up. But that because they know you're like something's wrong with this baby, something's wrong with this situation. And if you're, looking at a sleep schedule and like that's so like every 3-month-old baby should have this sleep schedule or like are they sleeping X number of hours a day or is this their wake window or whatever, and it just like isn't what your baby's doing. And if it's like an absolute uphill battle to like get your baby to this published schedule online, probably that's not the right decision for your family.
yeah, for sure. For sure. Is are there other common sources of mum guilt that you've also noticed? And how can women begin to confront those challenges and those feelings?
Yeah. I mean, like I would say the biggest things are like feeding and, and sleep. Like those are like the biggest sources of stress and guilt. And like, am I doing things right? Maybe like around developmental milestones, but I feel like it's not as acutely stressful. Do you know what I mean? Like, especially in that early postpartum, um, like you're not nearly as worried about is my baby getting enough tummy time as people are generally about like is my baby getting enough sleep in a day. Um, and I think a lot of it just comes again from like that societal pressure, right? There's a really great TED talk on she uses the term matrescence. Have you seen this? Where it's Alex something who does the TED talk. She likens it to adolescence, like the transition to motherhood is a similar transition to as adolescence, where you're like redefining yourself, your hormones shift, your brain changes. Like it's like a whole, you're a whole new, you are an absolutely new person. And can tell you with certainty that like when I was pregnant with my first, I had an expectation and that I did things with my first that I never would have thought that I would do
Oh, wow.
after I had like when I was pregnant. I was like there's no way that I would ever do these things, and then I was absolutely doing them with my first because I had to, because that was the kind of baby he was. And then with my second, the same thing happened again. Like where I was like, there's things that I did with my second that I would never have thought I would set, right? Like, but you don't know. And so just like having that awareness of like you don't know what you're going to run into until you run into it, and working on like letting go. I feel like therapists are really like therapists are really great doing any kind of like therapy work or like somatic processing or whatever, um to like let go of expectations, let go of like the need to control things, because the more you can allow it to unfold, the more you can let go of the pressure that because you get pressure from parents, you get pressure from friends, you get pressure from social media. So just like being able to let all of that go, and working with someone or working with yourself so that you're feeling confident with the decisions you're making, because and just like having the awareness that like every family is going to make different decisions and it's going to look different, and that's okay.
Hmm. How long have you seen someone have mom guilt for? Like, does it
Oh
start
my God.
a period of time
the,
or is it short time?
Oh, so long. This can go on so long. I fully like when I talked to my mother about like when I was born, she was like, "Oh yeah, these things happened, and like I don't know how like we probably didn't do the right thing there, or whatever, right?" Like, and you see, like if you have someone whose baby was in the NICU, or they had a really traumatic birth experience, that kid could be 10 and it still comes up in conversation because it's such a prominent, and like they're life-changing things, right? And you hold on to these experiences like for the rest of your life.
Yeah, it's true. It's true. I have like family members and still go back to like when the baby was, just born and like kids doing fine now, and it's hard to kind of like conceptualize that the kid is okay at this moment in time because
Yeah.
still like memory just is so permanent, and they just go back to that place where it was like a very difficult time period. So
Yeah.
yeah.
And like, did I make the right decisions, and how did we end up there? And it's a birth, like the birth experience and the immediate postpartum experience are life defining for mothers. Like for the people giving birth, it is life changing and defining, and the more we can, and I like when I was doing birth, and even like I still teach prenatal classes, like one of the things that I always say, keep it, or if I'm teaching doula trainings, right? um it's not about the outcome, it's about how the person is feeling in the experience, right? If just because you have an emergency C-section doesn't mean it's going to be traumatic.
Yeah.
It's like I felt informed, I knew why this was being recommended, I felt like I was involved in making the decision, then I felt good about it because like I was in control of that situation. Do you know what I mean? Or like had some degree of control, even if it was like an emergency. Um, Versus like I don't even know what was happening, and then I was being rushed to the OR, and I didn't even really feel like they told me why I was being rushed to the OR. And the same thing with like postpartum, right? Like I decided not to breastfeed, and I had good reasons to decide not to breastfeed, and I feel really confident in that. That was the right choice for me and my family at the time. Versus like I don't even know why I stopped breastfeeding. Like I really wanted to, and I'm not really sure what happened. And like I didn't get good support, and then I just like was stopped, and it, like or baby wasn't latching or whatever, right? Like those are different. Those are like very different things. And so like the amount of support you have, and the amount of confidence and like engagement with the process you have makes it a positive. It's always a big deal, but like positive where you're like, I feel confident, I feel good about all the decisions that I made, versus like, oh my God, like 10 years later, and I'm still like, that was one of the worst experiences of my life, right? Like,
That's so true. It's interesting to see how long it can span, and I agree. I love how you touched upon like just being informed makes a huge difference with your birth experience, and it's why I went into doulaing because I just noticed the impact of just having an informed birth can go
Hmm.
way. And then seeing it firsthand where I went to one birth, it was with YDD actually, and it was like one of my first experiences. And the labor was like really like stalled and so they switched over midwives and the first midwife, she was amazing, very holistic. The second midwife came in and she was not as holistic and she was like, you need a C-section. And then within like
Mm.
2 minutes, 10 people came in. It was like one of my first births that I went to.
Oh my God. Yeah.
Overwhelmed and like she was like, "Oh, like what's happening? What's going on?" And I had to explain, like,
Hmm.
do like this is the procedure. Are you okay with it? So, like, just having that person to kind of support and give information, is really needed because, I mean, things happen really quickly during labor and delivery. So, yeah,
Yeah.
you touched upon the importance of being informed.
Yeah. And I see that too. Like a lot of times I'll have clients where they reach out really early with their second for lactation support, even if like things aren't going wrong. They're just like, I just need someone in because they're like, with my first, I don't know, I was told in the hospital supplement with formula, but they didn't tell me to pump. And then I didn't realize I needed to start pumping until like 3 weeks later. And I wasn't sure how much formula to give them. So I ended up like overfeeding or underfeeding. I didn't adjust to how old they were or what they needed. And nobody told me how to bottle feed. And then I just like it took 6 weeks to get things actually under control because no one walked me through why they were making the recommendations they were making or like what might change based on the baby's age.
Yeah.
And so they're like, I need help like right away. Like I need you to come in at like 48 hours so that I like know what's going on. And even like when I'm helping people that early, I'm always like, I'm gonna tell you this now,
Yeah.
but like a 2 day old baby and a 4 day old baby, that's double their life. That's
Mm.
a different baby, right? So so just because this is working right now does not mean it's going to be the same in 2 days
Yeah.
or in 2 weeks. Like a 1 day old baby and a 2 week old baby, it's like different species, man. Like it's not the same at all.
Yeah, I didn't
Like
even
you have to
you have to conceptualize, yeah, like 4 days, it's been their whole life.
double their life. It's literally double their life. Um, So just like giving people the information about like this is what we're going to do now, but like I don't want you to be still doing this in a week.
Yeah,
Like things should be totally different in a week from now. And if they're not, like we need to really figure out why they're not different and this like we'll need to figure out a plan to adjust. Do you know what I mean?
for sure. For sure. I know we did touch upon this already, but what role does social media play in contributing to mom?
Mhm.
How can mom set healthy boundaries with it?
Oh my God, so much. So much. And it's funny because like I my social media is all other professionals. Like it's just, like I have like some OTs and speech pathologists and whatever, psychologists, whatever, all around parenting. And I can't be on there for very long. And I'm like well informed. Like this is my job. And I scroll for like 2 minutes through Instagram and I'm like I feel like I'm a terrible parent. So really like if a feed is making you feel bad, regardless of how professional that feed is or how much of an expert that person is or how much your friends like them or whatever, if a feed is making you feel bad, unfollow them. You don't need that. You don't need that. And honestly, generally, I recommend limiting social media as much as possible. You can get like timers on your phone or computer where it's like, did you know that it's been 15 minutes since you've been scrolling? Maybe you should stop. Do you really want to keep doing this right now? And if you're coming off of it feeling worse than when you went on, like you got to change your feed. right? And you have control over that. If something's coming up in your whatever when you're just randomly scrolling and you don't like it, there's a button that's like see less of this, right? So you just click that button, you see less of that. And just like monitor, right? Like self-awareness of like how are you feeling afterwards? And if you don't feel good afterwards, don't do
Yeah. There's so many things that you can do to kind of limit or to adjust, which I
it.
think
Mm-hmm.
of us don't utilize. Even myself, like as a naturopath, I'm not the most holistic person, and I have so much
Oh,
guilt.
neither am I.
Everybody, naturopathic student or a naturopath on one of my accounts, and they, going to the gym every morning at 6 a.m. I'm barely struggling at 8, and there's a lot of guilt. There's a lot of guilt.
Oh my God, don't feel bad. I'm not, yeah, I'm not, I'm like, my kids are jumping on my face at 6 a.m. That's what I'm doing. And I'm like, why are we doing
Yeah.
this? It's so early.
Yeah, there's a lot of
But
guilt.
holistic looks different for different people, right? And like, there's nothing wrong with doing what works for you. There's nothing wrong with sleeping in sometimes or using medication or, eating processed foods in moderation. Like we can, you like, and everybody's body is different, right? Like if you look at what I eat, what feels good in my body, and my window of tolerance for like junk food is different than the next person's
Yeah.
for those things. And so, like, if your body is feeling good and you feel healthy, like, keep on doing what you're doing, you know? And yeah, like, like, I feel like as practitioners, you're like, I should know better. But you're just a person.
It's true. It's true. It's one of the things that and something that you touched upon earlier, where you said that we're lacking intuition, I think is also intertwined with the social media piece, where like you're like, oh, what did this person say? Instead of like, okay, what do I know works for me? What's best for me?
Hmm.
6 a.m.
Hmm.
work for me, but it may work for somebody else. Whereas like 9 a.m. I function a lot better. So
Yeah.
I think all of those things.
Yeah. Yeah. My most consistent workout time is 10 p.m. And
Wow.
people are always like, "Oh my God, you're crazy. How do you fall asleep after working out?" And I'm like, "I don't know. I literally most of the time, like, and this is it's like 15 years like this. I like have weights in my bedroom and I work out and then I go to sleep."
Amazing. Wow.
Yeah. And
That's
so many people are like, "Oh my God, I could never do that." And I'm like, I couldn't wake up at 5:30 to go to the gym.
whatever works best for you.
Yeah.
That's-
Yeah.
Next question is, what is one piece of advice you wish all new moms could hear when it comes to decision making and managing guilt
Mhm.
at that period?
Yeah. You can only make the best decisions you can with the information you have at the time. That's it. That's it. And that, and like you are the expert in your baby.
Yeah.
Like even like my visits are long. Like I do home visits and I'm with people for like 2+ hours in an initial visit. They're really long. Um, and I still am not the expert in that baby. Do you know
Yeah.
what I mean? Like I can tell you what I see in that 2 hour window
Mhm.
and I can give you advice based on that. But if I leave and that doesn't make any sense at 3 o'clock in the morning, I trust you because I wasn't there at 3 o'clock in the morning. And you like I can't make decisions for you at that time because you're the it's like you and the baby. I was talking to my youngest is in daycare, like one of the other moms, and I was like, she was telling the story, and I was like, I feel this so deeply. She's like, I was like 4 weeks out after a C-section, and like the daycare's just down the street from the house, and I was like, I want to go for a walk, so I'm gonna like walk to pick up my kid. And she's like, we got there and it was fine. And then on the way home, I like hadn't brought the little side piece for the stroller, and my newborn was screaming because they were hungry, and my toddler didn't want to walk. And I was like, it's just me and these two kids. And like, I don't know how I'm gonna get out of this situation, but we just gotta get home like 4 houses. And it's like, this is it's like so stressful, but this is what builds resiliency. And like, this is why I think like moms are so resilient. Like new parents are, you're so resilient because you're like, if I don't get us out of this situation, nobody's getting us out of this situation.
You're like, we have no choice. We have to get out.
Yeah, yeah, we have to get home. And whatever you do in that moment was the right choice.
What did you do in that moment? I'm
Well,
curious.
she was like, it was this was another mom. She was like, I literally just like hiked up the toddler and like just screaming toddler under my arm.
Ex exactly. Yeah. Whatever you can do to get you to that end goal, then that's what you got to do.
Yeah, yeah, yeah. And you like you don't you're not gonna know until you're in the moment because no one can project. Like babies are different. Different babies are different. They have different needs. They have different temperaments. Having one baby and having two babies and the age difference between your babies makes a big difference too. Like if you have a an 18-month-old versus a 3-year-old, that's like a whole other is like two different again, double their life. So they're completely different. um and so like you can't don't judge other people for the decisions they're making because you cannot possibly know what the right decision is for them because you're not in that situation. And then also, like, don't feel guilty about making the decisions that work for your family because nobody else is in your family. Nobody else knows what's going on there. So you're the only one that can make the right decision because you're the only one who knows.
Yeah, that's so true. Yeah, I love that. Um,
Yeah.
the next question is, what are some signs that a mom may need to seek professional help to navigate
Mm-hmm.
the complexities of the postpartum decision making and guilt?
Yeah. Um, I would say like anxiety is a lot more common than postpartum depression now. Like in my clinical experience, I'm seeing like much more anxiety than depression, and I think that's like I've seen a big change in that since COVID. Um, but I think it was on the rise anyway. Like if postpartum mood disorders, I see it tend much more towards anxious than depressed. Not that I don't see postpartum depression, but I would say like the range of normal is it's normal to feel emotional instability in the first couple of weeks, right? As your hormones are shifting, if you're very tired, whatever, it's normal to like burst into tears for no reason. Where you're like, I don't even know why I'm crying right now. Or you're like, that's totally normal. Um, and then so like that kind of thing where you're like up and down, or even like worrying where you're like, I don't know if this is normal or if it's not normal.
Mm.
Like that's fine. But if you're worrying to the point where it's impacting your function, if you're guilty about things that you have absolutely no control over, if you're not having those changes in mood, like if everything is just dark or if everything is just stress all the time and there's no humor or levity or joy ever, like that's a problem. Feeling like numb, emotionally numb, that's also like that's a big sign to me like okay, something's going on. And even like honestly, we talk about postpartum depression, postpartum anxiety, but even just like postpartum overwhelm where
Mm.
you're like there's just too many things going on. I can't handle like I'm supposed to be looking after a colicky baby, making sure there's food enough for a toddler and like making sure my house is kept managed. Like that's too many things, man. Um, and so, and so like you're constantly feeling on edge and overwhelmed, and you're like, oh my God, I don't know how I'm gonna do tomorrow if tomorrow is just like today. Like that kind of feeling, that's also not you that's also a sign that you need some help.
How would clients or patients be able to get in contact with you for help?
Yeah. Yeah. You can find me at yourdowntowndoula.com. That's our website. And then our Instagram and Facebook is at Downtown Doula TO. And we also have a YouTube, which I think is also Downtown Doula
Perfect.
TO. And I think a TikTok as well.
Wherever you can get good information by like
Yeah.
professionals that actually do the work, I think is important. A lot of people do ask, do you want, even though we say limit social media, there are people that do um, can't afford to see a professional, but having these channels or these mediums kind of give them a little bit of insight. So it can be.
Yeah.
And my
Yeah. Yeah.
go ahead.
No, it's just like there's I don't know, there's so much information out there. So just like making sure that you're filtering it. Like, what are the credentials of this person that you're following?
Um, some people I saw, it was actually my boss. She sent me somebody, he's quite famous, but he was like talking about basically methylation. And she was like, is this true? And I do a lot of methylation work. And I was like, that's not exactly how it works.
So
Yeah, I'm like, it's not exactly a bit of propaganda. So I do think it's good to always like make sure you follow people that or listen to people that actually do have the credentials and do know what they're doing because it does make a huge impact.
yeah, yeah. And I think too, like if someone is making it sound simple, they're probably trying to sell you something. Like especially in the postpartum, like new babies, even probably pediatrics too, right? Like if someone is like, I can fix all of your problems without having seen your baby, like they're just selling you something.
Mm.
And it's predatory, honestly, it's predatory.
Mm.
um so just being mindful of that, like your baby is a whole person and your family is a whole unit, and your family unit is different and has different needs than the next family unit. And if someone is trying to give everybody the fix that's going to work for everyone, then they're not.
Yeah, then it's true. And there's a lot, and I think with like the world that we living in, a lot of people play the role of a naturopath without having naturopath credentials. And it's like how
Hmm.
I feel like we're fighting against the grain of like, okay, no, but I actually have four
I
years
do actually know what I'm talking about. Yeah.
like, like I like sometimes I'll have patients and they'll be like, oh, but I read like this is good. And I'm like, but you don't need this. And but they're like, but the studies or this person on social media. And I'm like, but I know what I'm saying. So it's
Yeah, yeah, yeah. That might work for the person on social media, but like I don't think it's gonna work for you in this case. Like,
don't waste your
because
money.
your blood work is different. Like your digestive system is different. You are a different person than that person on social media, you know?
So it's definitely I would say social media it's a good and it's an evil as well. Yeah.
Yeah, for sure. For sure.
So the last question that I have, which I tend to ask everybody on this podcast, is given your experience, what kind of support do you feel is missing in the healthcare field and that should be implemented?
Mm, time. I feel like time is missing in the healthcare fields. And I'm very grateful that like I'm not in the OHIP system and people can use benefits instead. Um, because a lot of times I hear like when you hear this with pregnancy too, right? Like, well, the OB was just in and out, and then I didn't even get to ask them the questions that I wanted to ask. And then, I had a lactation consultant in the hospital in the postpartum ward, but they had 15 other people to get to, and they were only with me for 5 minutes, and they said everything was fine, but like my nipple was bleeding and falling off. Like it's like, or they told me it was normal, and then they left, and I wasn't able to ask questions. So like honestly, I think the biggest missing piece in our healthcare system is the ability for a practitioner to actually spend time with people, because I genuinely think that like people who go into obstetrics and the labor and delivery wards and those postpartum wards, people are there because they want to help people have babies and healthy and whatever. Like I don't think that there's malintent going on there. Do you know what I mean? I just think that like they're just don't have the time to like really sit, especially with the people who are having like normal, I'm saying that in quotations, like normal concerns,
Yeah.
right? Where they're like, I'm not sure if my baby's getting enough, or I'm not sure, like I'm having pain with latching, or The feeding is really inefficient. Like I'm feeding like 20 times a day or whatever. Like those are like like the baby's still gaining weight. The mom is recovering reasonably well postpartum. Like there's nothing wrong, quote unquote wrong, but like there's so much going on there that's like impacting the parent's mental health and maybe like impacting their ability to care for their baby and whatever, but they just don't have it because there's nothing wrong. They don't have the time to like sit with them. Whereas maybe if there's a baby in the NICU, they do have the time because that baby's like, there's like medical conditions going on. So it's like, okay, we're gonna take the time to like be with you. I feel like pregnancy and birth and like new postpartum, it's like because it's not a medical condition, you just like don't get the time.
Mm.
And
Yeah.
even a lot of time with medical conditions, like how long does it take for endometriosis to be diagnosed? Like 8 years on average, right? Like you just don't have the people don't have the time to sit with a patient and do a full intake.
Yeah. Which is the benefits of our work, is that we
Yeah.
so see Dr. Sarah.
Yeah, yeah. Um, only if you have babies.
Yeah. We're so specific here. I love it.
I see people who aren't pregnant sometimes, and I'm always like, oh, we're just doing like a regular history here. Okay, this is fine.
Yeah.
Like 80% of my patients are families with babies under 6 weeks old.
Wow.
Like
Wow.
I have a very specific
So niche.
niche. Yeah. Yeah.
It's
Yeah.
because you
Yeah.
have a demographic that works for you. And I think that's what makes you a good provider is that you work within your limits and try, like,
Mhm.
that, okay, this certain age group doesn't work for me. So I think
Yeah.
I tell my friends and family, like, see somebody that will work for your needs instead of like, you can come and see me. But like,
Yeah.
if I don't really fall in line with that,
Yeah.
then I'm not gonna be the best person.
Yeah. Yeah. Yeah, for sure. And I like YDD is like we're very focused on the perinatal period, and we have like a bunch of naturopathic doctors, but all of us are like pretty focused on the perinatal period. So a lot of times we'll have NDs like refer their patients over to us. We see you while you're pregnant and when you have your baby, and then we send you back to your other practitioner.
Which is nice because then you
Yeah.
feel like some NDs are worried about poaching, like, oh, I'm going to lose my patient, but you'll be, yeah.
Yeah. I'm like, please go back and see your other provider for like your pediatric.
Yeah.
Once your kid's on solids, I'm like, please go see someone else.
You're like, bye, I'm done. I'll be done.
Yeah. Yeah.
Amazing. Amazing. Well, thank
Mhm.
you so much for joining the Baby Mama's Doula podcast. Like Dr. Sarah said, you can find her at YDD. It's a wonderful company which I have been a part of, so I can attest that it is the place to go. I refer my patients to you guys all the time.
I
So
miss you.
I miss you guys as well. So hopefully our paths will cross again.
Cross again. Yeah.
But thank you, and
Thank you so much for having me.
no worries, no worries. And this will be found exclusively on babymamasdoula.com.